My name is Ashley McMillan. I'm a nurse practitioner at Upper Cumberland Urology here in Cookeville. Urology is a vast specialty. We deal with a lot, including issues with men and both women. A lot of kidney stones, that probably keeps us in business. Urinary tract infections, incontinence, or another word, leakage of urine, enlarged prostates, and the list goes on and on. Great question. We have a lot of women who come into the office after having incontinence for years, saying, you know, it's very embarrassing. I didn't want to let anyone know. I'm just going to spend hundreds of dollars each month on pads. So what we offer when they finally get to us is, trying to work with them, seeing if medications will help. Pelvic floor physical therapy is a great option if you're having stress incontinence or leakage with cough, sneezing, laughing. Conservative measures at first, changing diet, modifications. If that doesn't work, we do offer a test that we do in office. It's me and the patient, and it's called a urodynamic study. And it's a test on the bladder that shows what's causing this leakage and how can I help you out with it. So I see them first.
Okay.
They usually have a follow-up with either myself or Miss Connie. And I will say, Connie is now doing telehealth, so if patients still don't feel comfortable with everything that's going on, she can reach out to them by video or by phone, get their information, and then send them to the office to schedule that UD study. But we usually have a follow-up first, see what's going on with them if they've ever tried anything, seeing what kind of incontinence it is, because there's two different types. There's stress incontinence, like I mentioned. Usually that's more so in women after having children. It's urinary leakage with cough, sneezing, laughing, and then there's urge incontinence where you can't make it to the bathroom in time. So we kind of pinpoint and see where we're going to go. And then we set you up with medications. Pelvic floor physical therapy do not help. We set you up for that urodynamic study, and it just shows us more of a vast, what is your body doing during the whole voiding process? And then once we determine that, we can kind of determine, is this going to be more surgical or can we try more medications to help you out? These two incontinences are treated completely different. So there are medications that will work, but there's also surgical interventions that we can do. One of those would be axonic. A lot of patients don't understand or know about axonic, but it is a little device, a stimulator. We like to call it a pacemaker for the bladder. And it helps with the urgency, the frequency, and leaking on yourselves. And we have great representatives that come to our office and help us out. And we also do that procedure initially in our office, so you don't have to be put to sleep.